Breast cancer in men is rare, but it does happen. Each year, more than 2,700 cases of breast cancer are diagnosed in men in the US, and over 500 men die from the disease. It's important for men to know the warning signs of breast cancer and to report any unusual signs or symptoms to their healthcare provider. The most common sign of breast cancer in men is a painless lump or thickening in the breast, chest, or underarm area. But any change in the breast or nipple can be a warning sign of breast cancer in men, including a lump, hard knot, or thickening in the breast, chest, or underarm area. It is usually painless, but may be tender. A change in the size or shape of the breast, dimpling, puckering, or redness of the skin of the breast, an itchy, scaly sore or rash on the nipple, pulling in of the nipple or other parts of the breast, or nipple discharge. When breast cancer is detected at the same stage, survival rates for men are similar to women. However, men are often diagnosed at a later stage of breast cancer than women. One reason could be that men are less likely than women to report signs and symptoms, which could delay a diagnosis. Most men don't know they can get breast cancer, so they may ignore warning signs, or they may not tell their healthcare provider about them. They may also be embarrassed or worried, or they may not think the changes are worth mentioning. Some men develop benign breast conditions, including the most common one, called gynecomastia, or enlargement of the breast tissue. Gynecomastia is caused by a hormone imbalance and does not require treatment unless it causes pain or treatment is desired. Treatment options include hormone therapy or surgery. Some studies show gynecomastia may increase the risk of breast cancer in men. Other benign breast conditions that are common in women, such as cyst or fibroadenomas, are rare in men. If you're a man who has noticed a change in your breast, chest, or underarm area, talk with your healthcare provider. Don't wait. If you're not comfortable with the evaluation of your condition, it's okay to ask your healthcare provider to order tests to find out more information or to get a second opinion. Although some factors can increase the risk of breast cancer in men, most men with breast cancer have no known risk factors except for being older. From 2018 to 2022, the most recent data we have, the overall median age of a breast cancer diagnosis for men in the US was 69. The median is the middle value of a group of numbers, so about half of men are diagnosed before age 69, and about half are diagnosed after this age. The median age of a breast cancer diagnosis for men is older than for women. Overall, the median age at diagnosis for women is 63. Risk factors for male breast cancer also include a family history of breast cancer, BRCA1 or BRCA2 inherited gene mutations, a rare genetic condition called Klinefelter syndrome, and being overweight or obese. Other possible risk factors under study include diabetes and exposure to large amounts of radiation early in life. Breast cancer screening is not recommended for most men. However, the National Comprehensive Cancer Network, or NCCN, recommends that men with a BRCA1 or BRCA2 inherited gene mutation start screening at age 35, including having a clinical breast exam every year and doing breast self-exams. The NCCN also recommends men with a BRCA1 or 2 mutation have a yearly mammogram starting at age 50, or 10 years before the earliest known breast cancer in their family, whichever comes first. Men who have a BRCA2 mutation should also get routine prostate cancer screening, and men with a BRCA1 mutation should consider whether this testing is right for them. The NCCN recommends pancreatic cancer screening for men with a BRCA1 or BRCA2 mutation and a family history of pancreatic cancer. Most male breast cancers begin in the milk ducts as invasive ductal carcinomas. Men are also more likely to be diagnosed with breast cancers that are hormone receptor positive and HER2 negative. Treatment for breast cancer may include some combination of surgery, radiation, chemotherapy, hormone therapy, HER2 targeted therapy, and/or other drug therapies. The specific treatment a man receives is determined with his healthcare provider based on his individual circumstances. Social support is important after a breast cancer diagnosis. Men with breast cancer may feel alone. Support groups for breast cancer may only have female members, so joining a support group for men with any type of cancer may be more helpful. There are also peer mentoring programs to connect one-on-one with another male breast cancer survivor. A healthcare team member, such as a social worker, can provide information about available support services. You can also reach out to Komen's Patient Care Center. Our navigators offer free, personalized support to patients, caregivers, and family members. They can share trusted breast health and breast cancer information, connect you to services and resources, provide emotional support, and more. Get connected with a Komen navigator at 1-877-GO-KOMEN or 1-877-465-6636, Monday through Thursday from 9 a.m. to 7 p.m. Eastern Time, and Friday from 9 a.m. to 6 p.m. Eastern Time, or by email at helpline@komen.org. To learn more about breast cancer in men, you can visit the Male Breast Cancer page on komen.org.